Hi, my name is Candy Arentz, and I'm the breast surgeon at Houston Methodist West. Today we're going to talk about mammograms. Mammograms are pictures of the breast that are done once a year to look for breast cancer. We can find breast cancers on mammograms when they are microscopic, and usually breast cancers have to be about an inch before you can feel them. And that's why it's important to get mammograms. If you've never had a mammogram, you may be wondering what happens. When you come in for your mammogram, you'll check in at the front desk, then you'll be escorted back to an exam room after you change. In the room, there's going to be a large machine. You'll place your breast between two firm metal plates. Now, those plates are padded, and the technologists are excellent on your comfort and getting you positioned correctly. It sounds a little intimidating, but really it's very easy. Usually it takes 2 pictures of each breast, so 4 total. And remember, if a picture can save your life, then this is what we should be doing. After your mammogram, you'll change back into your clothes, so really book about 30 to 45 minutes for your entire mammogram experience. Screening mammograms should start at 40 and should happen every year. If you have a family history of breast cancer or are having a problem, like you notice a lump or a change in your breast, you should always report that to your doctor because we can do mammograms even earlier than 40, and you don't really have to wait a whole year if something changes after your screening mammogram. Once you've had your mammogram, it will take the radiologist a couple of days to read it. And ideally, you'll get a letter in the mail that says everything was great and we'll see you next year. If there is something seen on the mammogram, they may ask you to come back in. And don't worry, we know that at least 10% of women are asked to come back in. And so you come back in and we can focus and do what's called a diagnostic mammogram. And that's where we're looking at one particular area in the breast. And often we do an ultrasound the same day. On that day, with your diagnostic workup, the radiologist will come in and talk to you the same time. And so then you will know the plan. The plans are often, hey, we saw this, everything looked normal. We'll see you back in 6 months just to check. And the other option is they may recommend a biopsy. About 10% of women who get called back for that diagnostic mammogram do go on for needing a biopsy. And the biopsy is done where we put in a small needle into the breast so that we can take out some tissue to look under the microscope to get pathology. But still then, even most of what we biopsy is not breast cancer.